So first, I'll review why older adults require more nuanced care. Then I'll talk about the geriatric assessment tools to help identify individual level syndromes and conditions in older adults. And then I'll review some of the landmark lymphoma studies that tailor chemotherapy specifically to older adults. And lastly, I'll review some health modifications that anyone can make to improve their survival from lymphoma. So, older adults need thoughtful and nuanced care. They're underrepresented in clinical trials, so we cannot directly apply trial results to them. And they often have comorbidities that place them at high risk for complications from treatment. They have logistical concerns, which can make it difficult for them to complete certain therapies. So, for example, some of the lymphoma treatments require caregiver support for frequent visits and lab monitoring, as well as monitoring at home for any side effects or complications like infection. Now, I'm showing this figure to demonstrate that older adults with cancer are complex. Their care can require an interdisciplinary team to address unique concerns. So, for example, looking at geriatrics, oftentimes if people are feeling well and they don't have a lot of other uh, concerns, a geriatrician is fine to help co-manage with an oncologist. But for people who have a huge symptom burden from their disease, or if they have a lot of complex decision making that needs to be done, then a palliative care physician can also be helpful in conjunction with a geriatrician and oncologist. And this figure illustrates how the body changes with aging and what this can look like. So, for example, in the brain or the central nervous system, there can be a loss of some of the mechanisms that allow the nerves to communicate with one another. And this can result in issues of weakness and increased risk of falls. So, our treatments in cancer care need to adapt to aging bodies. So, the geriatric assessment is really an umbrella term to encompass multiple tests that assess different aspects of life. So, these include, for example, function and ability, which is how an older adult can complete their day-to-day activities. Disease severity and comorbidities include different medical conditions that older adults can have in addition to their cancer. Mental health and cognition really focus on whether people have depression, anxiety with their cancer care, or memory loss, as well as their level of support. So, do they have family or friends nearby, neighbors? Who is their support network? Additional evaluation on top of this includes evaluating nutrition, medications, and how they can interact with chemotherapy, and the environment in which adults live. So, is it safe? Do they have a lot of stairs at home? What's their bathroom situation look like? Now, using multiple geriatric assessment tools provide a holistic understanding of older adults. And I'm showing one of the most commonly used tools that evaluates someone's ability to function in their day-to-day activities. It's called the Activities of Daily Living, and we divide it to basic and instrumental or independent activities of daily living. The basic activities of daily living really focus on self-maintenance. So, are you able to feed yourself, drink, go to the bathroom by yourself? And then the independent or instrumental activities of daily living focus on how well someone carries on functions that require more attention and effort, such as grocery shopping, doing chores, cooking, and handling finances. The cumulative illness rating scale is a scale that was used in some of the clinical trials, and they have one specifically for older adults. And it goes through someone's entire body system and has that individual rate their level of impairment or their level of disease in each category. And based on that, we can understand whether someone would be categorized as being fit for treatment or unfit. A physical exam tool that I like to use in my clinic is something called the timed up and go. And the timed up and go helps me assess how well someone walks and whether there's any issues with their balance. So what I do is I have patients get up from a standing position or a sitting position, and they'll stand. And so I watch how they stand and how long it takes them to stand up from a sitting position. Then I have them walk about 30 feet. So definitely across the entire room, turn around, and then walk back and sit in the chair. Now, a normal test is less than 12 seconds. However, research has shown that if someone takes longer than 20 seconds, then this is a sign that they could be dealing with issues of frailty. Now, this is really important because the geriatric assessment has astounding impacts on care. So here I am showing data from one of the largest clinical trials looking at geriatric assessment. So this is a randomized clinical trial of 718 older adults across 40 clusters of community oncology practices in the United States. And they had solid tumor malignancies as well as lymphoma. So this study compared a geriatric assessment intervention with the usual care and evaluated the rates of chemotherapy-related side effects. Now, the intervention was that the oncologist who treated these patients received a tailored geriatric assessment summary and management recommendations. And the participants who received this intervention had lower rates of chemotherapy side effects or toxicities. So, for example, if we're looking at any toxicity here, in the usual care arm, 86% of adults experience any toxicity, compared to 64% who received the geriatric assessment intervention. So when you do the math, this means that 5%, or excuse me, 5 people need to have this intervention, this geriatric assessment intervention, to reduce side effects for one person. That's really remarkable.